Okay, so for today's demonstration, I'm going to be performing wound care on an abdominal wound. So I have checked the MD's orders for the dressing change. I know what supplies I need to change the dressing with, so I would have performed hand hygiene and collected my supplies, and I offered the patient analgesia beforehand as well. So I'm performing hand hygiene again and then entering the patient's room with a general survey and safety check, introducing myself and explaining the procedure. So hi, my name is Sarah Kennedy. I'm a third-year student nurse in the University of Manitoba. I'm just here to perform your dressing change today. Is that okay? Good. And are you able to tell me your name and birthday? And I just want to check the armband. The name and birthday also matches who they say they are, and then it matches what was on the MD orders for the dressing change. Okay, so I'm going to be performing a dressing change on you. So just taking your old dressing off on your abdominal wound here, irrigating it with normal saline, and then putting a new dressing off. Is that still okay to do? Okay, great. So I'm going to begin setting up my sterile field. This table here would normally be at waist height. It's a little low for today, but normally it would be at waist height. I cleaned it beforehand, so I wiped it down before putting my sterile tray on. So I'm going to perform hand hygiene again, and then I'm going to start setting up my sterile field here. So this is a garbage, it's a little one, but I have a bigger one to the right here. It's just on the ground. I don't think you can quite see it from this angle, but okay. So just being mindful of my 1-inch borders as well. I'm going to be taking the sterile drape out. I'm not going to be using it for this video, but I'm just going to put it to the side for right now. Garbage. I'm also not going to be using this garbage just because I have the 2 already. I just like taking these out. So now I'm going to begin adding to my sterile field here. So I'm going to start by putting my little ruler beside. So normally this Curlex would be in a sterile packaging. I'm going to try and demonstrate just with the Ziploc, but you'd wing the sterile packaging back. Again, this would normally not be opened already, but I'm going to add that. Adding my cotton tip applicators. And again, this table would be at waist height normally, but I'm working at home. Okay. Okay, so I'm adding my scissors. So normally these would not be open either. But I'm going to wing them back. And then I'm using a 20 gauge Cathlon here. So normally there would be a needle attached to it, but because I've used it a bunch, it's been retracted. And it would be better to put it on with the forceps, but just because this package has been opened so many times, I'm just going to drop it in. And then normally you would again retract the needle because once you have your sterile gloves on. Then I have my 30cc syringe here. For irrigation. Okay, and so I have 2 new 4x4s because that's what I'm going to be covering the wound with after I pack it. Just being mindful of my 1-inch borders as well. I'm just going to add my normal saline, just being mindful because I don't want any drips to get onto okay, and I didn't get any drapes outside the tray, so that's good as well. Okay, so now that that's done, I'm going to perform hand hygiene again. I'm going to take off the old dressing. So when I take off the old dressing, I just want to note the color of the drainage, the amount, like the percentage of it, and just any odors that are coming off. So whether it's like sanguinous, serosanguinous, the percentage of it, and just again any odors. So these are my clean gloves. So just taking off the old dressing. Again, noting the color, amount, percentage per se. So let's say it's serous drainage, and then taking out the old packing. So yeah, just giving that a good look and smell before disposing of that. And I'll do more of an assessment after, once I've cleaned. And then I'm going to be disposing of the gloves as well, performing hand hygiene again. And then I'm going to be putting on my sterile gloves here. Just being very careful when I'm putting the sterile gloves. And again, normally this would all be done at waist height. And these can be adjusted after once we have them on. Okay. So now I want to start by irrigating my wound. So I'm going to be irrigating, I'm going to draw up 10 cc's. And I'm going to irrigate from cleanest to dirtiest, so that more of the center to the outside. And I'm going to normally irrigate until it runs clear. I'm just using the 10 cc's for the purpose of the video, but normally you would do it till it runs clear. I also don't want to get any of the liquid on the peri wound because I don't want it to bring any contaminants into the wound bed. So again, I'm using my 20 I'm using my 30 cc syringe to draw up 10. So I've drawn up 10. I'm going to be attaching the 20 gauge Cathlon. And again, so I'm about 10 centimeters away. So just making sure that I'm not going past the peri wound there. And just for the purpose of the video, I'm not going to use the whole 10 cc's, but normally I would irrigate until it runs clear. I'm going to drop that. There's the garbage there. So now I'm just going to dry that. So using 2 4x4s, or just one, and then, so I don't want to let it touch the tips of my gloves here, so I'm only going to drop it in, and I just want to be mindful that it's not soaking all the way up to my gloves. So then I'm disposing of that. And I'm going to use one more just because there is still a bit of water in there, or the normal saline. It should be about as moist as an eyeball. So again, making sure that it's not touching the gloves. And then I need to clean the peri wound as well. So just making some rosettes here. Dabbing that with the saline. And then I'm going from cleanest to dirtiest as well. So let's say the head's towards the farther side, 1 swipe per wipe. So 1 swipe per wipe. And then dabbing that with the saline again as well, 1 swipe per wipe. So that didn't touch the forceps, so that's okay to keep going. And I did do the 1 swipe per wipe throughout the whole surface there, so I can keep going. So I'm going to dry. And again, I'm using the 1 swipe per wipe method. 1 swipe per wipe. So to dry the peri wound, and then disposing of that. And then to the other side, just 1 swipe per wipe to dry. Okay, so at this point, I want to assess the wound bed, or the wound. So you can note the presence of any granulation tissue, the condition of it, any signs of healing. I also want to note the length, so that's about 13 centimeters. The width, so that's about 2.5 centimeters. And then the depth, so that's about 3 centimeters. So I'm going to dispose of that as well. Okay, So, and again, noting any signs of healing and the condition of the wound. Okay, so now I need to start packing. So I'm going to pack with the Curlix here. So I have it saturated in the normal saline, so I need to drain that out. Just being very, very mindful because I don't want to get any drops outside the tray. Okay. And again. So I've been very mindful not to get any drops outside the tray. So now I can start packing. So I don't want to pack too tightly, and I don't want to go above the surface of the wound, and I also don't want to touch the peri wound more than maybe 1 or 2 inches outside or at all, just because I don't want to bring any contaminants inside. And again, we're not going above the surface of the wound. I don't want to touch the peri wound. Okay, so now that that is all packed, I'm going to show you the packing at the very end just because my camera's propped up, but I can dispose of that. And I'm going to go and grab my sterile scissors. Okay, so just putting that there and then disposing of that as well. So I've acknowledged the fact that my hands are no longer sterile. I just want to get that in more. Okay, so now I'm going to use my forceps to cover that. And again, I'm going to be showing you the packing at the end with the camera. Okay, and then I'm going to be taking that, my gloves off like this, and then performing hand hygiene, and putting my abdominal wound on, abdominal pad on. And then I'm going to be using the medical tape. Okay, so that's done. So I'm just gonna open it up because I want to show you the packing before I